I don't know, maybe I can stand up and just...
Yeah, or you can just watch from here too. I'm going to get all her things here and her t-shirt and everything and get my bath water. This is kind of, this is her first bath too. So this would be the things as I would get ready for, now like during the winter their skin dries out just like ours does too, so you don't have to do a bath every day. But in the summertime, they kind of like one every day like we do. You know, they feel sweaty and it helps them rest then after that too. Of course, we don't want her to rest, but she needs her first bath, so I'll do that. And then they usually nurse pretty good after that too. Another thing I should do is trim her nails. I was going to get that. So I'm going to use the basin here too. So, and you test it either with your wrist or your elbow because those are used to more sensitive temperatures of water. You're going to give a baby a bath in a sink to make sure that the temperature doesn't change as it's running the water so you don't burn your baby too. Just the common sense things too. So I'm going to get my bath water ready and I'll do her prints here. Do that. And I'm going to wake her up then. Out here because then I'll do her footprints because she's not going to like me too well when I rust her out there a little. And usually I had like I had a blanket or a sheet, so every night when I either sponge them up, because you could sponge them up, you know, do their face and hands and bottom, or give them a bath, I just usually had that nice blanket or sheet, and then I bring my clothes there because we've got her clothes. I'm going to use the swaddler and then our hat, and then I'll get her diaper out too that we'll put on, and it only takes about 10-15 minutes, and it makes them feel a lot better, and that way you can see your baby too. So I will get everything ready here, and I'm going to use the Visoderm for baby too. That's in your drawer there. And it's the pink and white bottle there too. I'll get a diaper out for it too, but this is it right here. It protects against Staph aureus in the nursery. So we'll just use water on her face. And then I've got my cotton balls. We're going to use one for each eye, and then one for her nose to clean out her nose. I'm also going to show you how to use a bulb syringe too to suction their mucus out of their nose, because when they get a cold, they only breathe out of their nose. So they aren't going to nurse as well or take a bottle if they their nose is all stuffy or if they got a cold. And they hate it. They just hate it when we do that. And my comb and my diaper. Maybe better. Put it there. Okay. I'm going to do her footprints over there first, I think. I don't know if I can get I might be able to do them so you can see them here. I'll bring it over here. You want me to turn your chair there a little?
I don't know if I can stand up a little.
I think you could.
Yeah, just a bit once.
Stay in the way.
Okay, because we also do the pink one here too. This one here too, for the frame part.
Yeah.
Okay, that's separate here. So I'm going to get baby. And we got our Visoderm out. Did I keep that out there? Here it is. For baby in the bulb syringe. Alright, honey bunch. You aren't going to like me too much, but... And it makes them feel a lot better too.
Yeah.
I'm going to take one of her blankets with her there. Okay, little Melina. Pretty baby there. And we'll save that hat. I always put their first one in here. In there. do your footprints over here. Spread them out a little more. That's pretty good, so I get all the toes. There. And then I'm going to do her hands. So I have to kind of bring her up like this. Oh, she's got beautiful hands. Beautiful. Okay, and I'm going to tickle them so they fan out a little bit. There we go, honey. There we go. And then we'll do the other one, honey. This band is on kind of close to the edge there. And this one I have to get out a little more. There. No, not too bad. We got all the we got all the fingers on there, don't we? Okay, honey. Now we're going to do this on this one. Let's see. No, this one looks like it was already used. Did it? Looks like it was smudged already. Here, we have to get a different one for that one, honey. Get another one in here. There's a burp. We'll use a fresh one for the frame there. And the footprints will be done. Okay, honey bunch. There, you'll be woke up for this. Okay, honey. We got them all there. Oh, we got all the toes. I don't like that one. I only get a few toes. We've got that. Okay. We can let those dry a little bit there. Just sit them there. So then we're going to go to our baby here. So we're going to do the bath then, and I talked to you a little bit about oh, they did put her. Is that how you spell her middle name too? Is that right on there?
Yes.
Yeah.
Okay.
Yeah.
So we've got our bath here, and we tested it with their wrist or elbow. It's not overly hot at all. And we've got our cotton balls, and I've got my washcloths. So we're going to take, I'm going to take one cotton ball and go from the inner corner of her eye to the outer, turn it over and go on to the other one, the same one. And then that way if you have any infection, you don't cross-contaminate from one to the other. So here we go. There, beautiful eyes, and discard. Then I'm going to take one for her nose. And her nose there. Now this would be the bulb syringe that you would use if she would have any cold or anything like that. So you're going to squirt the air out first, gently position her head, and go in one nostril, squirt it out, push the air in again, and go in the other nostril. And they hate it. They don't like it. As you can see, she doesn't like it at all.
It hurts.
But it helps them, and it helps them breathe better. And I'm just going to do her face here. And that's just with plain water. Behind the ears.
The nose a little bit like.
Yeah, over there. Come on. show you how to swaddle too, because I'm going to do her hair next. So I've got my blanket like in the diamond shape with one corner over. So then you're going to hold her arm down, and because I'm going to do her hair first. And then this bottom part will come up and go over the shoulder. I don't know if you've taken the classes, but in the 5 Calming S's, the happiest baby on the block, Dr. Harvey Karp is a well-known pediatrician, and we have that DVD, and he does it very well. He does it better than I do. And then this one goes around like so. And then I'm going to do her hair here first, and then we'll go to the rest of the body. Put my towel down so I have that after. In the garbage. Yeah, yeah, that's garbage. So. So then I'm just going to do her hair here. Oh, she likes it. She likes it.
Oh no.
And this is just the Visoderm and the shampoo. Oh, nice. She has a nice shaped head too. It's a C-section head, cesarean section. It doesn't have to mold to the birth canal, does it?
That's true.
Oh, and a beautiful hairline, doesn't she?
Yeah.
That's not from me.
That's not from you? Now, Dad.
Oh my god.
There. Nice, honey. You like that. Now, they have the little fontanelles. They're the soft spots. This one will close in 12 to 18 months. It's soft. There's one that closes in 3 months.
Okay.
Now, sometimes babies get what's called Cradle Cap, which is a crusty, kind of yellow crust on there that can develop from the sebaceous glands, and that is not dangerous or anything to them. Did your other daughter get any of that at all?
A little bit.
A little bit. So if you're going to be shampooing the hair, and you only do that a couple times a week, to put a little bit of drops of baby oil on, and that will kind of soften them, and then you can lift it off a little bit with, you can just loosen them and then shampoo the hair a couple hours later. I don't know if I can give her the Gerber baby curl here, not too much there, but there, she's got a few little curls there. Okay, then we'll go to the rest of the body. Okay. Now, often the little boys as well as the little girls can have a little bit of raised nipple tissue, and that's normal. That's from the hormones passed over from you to her. Okay. The little girls also have in their labial area often. We hit the jackpot. She needs a bath.
Let's take the picture of the
Take the
jackpot.
picture there, Daddy. She needs a bath.
That one's for the grandparents.
Did you get it?
Oh yeah.
Okay. Everything's working. Right in time for the bath, Dolly. Yeah.
It's like she was like up maybe with her legs. She was like making.
It didn't seem to bother her. Maybe I'll take one of those wipes in there too. Over there. You see it there at all?
Yes.
Okay. Yeah, and those are yours too to take home too. So, yeah, she's doing everything that she should. Yeah. Here. And often in the labial area that we were talking about, they can have a little bit of mucus discharge, and that's often, little girls will have it. A large percentage of them have it, and that's also from the hormones passed over from you to her. That'll disappear in about a week or so. She doesn't have, but she has a little bit maybe in there, not much, but a little bit in there. So that'll disappear. She won't get it's kind of like a period. They won't get another one until they're like 12 or 13. So, okay. And then, now my girls, I had 2 girls and a son, they would get a little more red in their labial area when they were teething or had a cold. So you can always start using like Desitin ointment there too, you know, if that happens, to start, it's kind of like a barrier.
Yeah, I have it at home. I want to do it.
Sure.
Like
So, yeah.
cream.
Yes. So then we're gonna do a bath now. This one is okay. So then I'm gonna put her in the tub here, and this is just our little tub like we do now. But at home you have your own bathtub too, and we can use our Visoderm. On the hair you can use this, or you can use like Johnson's baby shampoo, whatever you have there. And I'm going to clean around the cord too. The cord will fall off in about 10 days to 2 weeks. Sometimes it will just hang by a thread at all. So, and I'll kind of, they don't always like their bath right away, but they learn to like it too. So it's good for you to see that they cry in the hospital too. And then you can finish cleaning under the arms, because sometimes they're pretty well flexed, so it's hard to get to it. So then you can kind of clean under there, and then they kind of just move away there. And in the creases. There, little girl. Okay. And then I'll bring my... And it doesn't take very long, and that way then you can kind of see. This clamp will come off tonight, but like the cord will fall off. You might even find it in the diaper one morning too. So now if the phone rings or the doorbell rings, always have your cell phone there with you, because you know the phone's gonna ring. And I'll give her her little tummy time. They need that in a supervised area. Like start with a minute a day and increase it each day so they get up to 20 minutes. The time when they're in your view. We used to put our babies to sleep on their stomach, but it's a big no-no today. You have to put them to sleep on their back. And I guess it has cut down on the crib deaths, and I think that it's because we sleep more soundly on our stomach. So, but they still need their tummy time too, so that they learn to use these muscles and then reach up, and then pretty soon they're rocking, and then they'll flip over. But if you wait until they're like...
Take this one. Oh,
Yep.
that's too late.
Did she show you a finger?
Oh.
Yes, she showed her finger. It's too late.
So what did she do?
Yeah, she showed her finger.
Oh.
She
Should I
did it
flip her
right.
now?
Yeah, she did it right away. Yes.
Oh, I think she's going again.
Yeah?
She's trying here.
Puckering.
She said, you're going to give me a bath. I'm going to make it worth my while here. Here's Pat. Okay. And then we'll bring her over here. And then we'll put her t-shirt on her and her diaper. And then the diaper always starts like so, and then you open it up. And then the tabs go under the bottom. We check a baby's temperature under the arm. The baby's temperature is greater than 100.4. In the first 2 months of life, we don't give them any Tylenol, but bring them to urgent care or the clinic, because it could mask something that might be more seriously wrong with them. So then the tabs open up, and then you'll just put them over so they're secure around the legs.
So how much the temperature is normal? How?
If it's usually around 98.
98?
Anything below 97.5 or 100.4 are abnormals.
Okay.
So, but they might be too warm. You know, if you have a fever, take off the extra things, and you'll know your baby better than anybody. You'll know if there's